Thanks for staying with us. Byron Abuli is our sign language interpreter. And Africa was predicted to suffer the worst effects from the pandemic owing to its socio-economic cultural dynamics. However, 1 year after the virus was first reported on the continent, its resilience is a subject of scientific interest, with death rates remaining low. Health experts are, however, concerned and warning the emergence of new variations of the coronavirus could present a new challenge. Yusuf Farah examines the effects of the virus on the continent.
As of Thursday, the Africa CDC was reporting the total number of COVID-19 cases in the continent since the advent of the first case stood at 3.9 million, while 106,000 people had died. Egypt was the first country to confirm the first case of COVID-19 on African soil on the 14th of February last year. 3 months later, the viral disease had swept across the continent. However, the infection and mortality rates were not as adverse as other continents, leading to experts having different theories as to why this was the case.
If you can say that the measures which have been put in place, I think they've been followed fairly well. Of course, as 1 year pandemic, people become a bit tired. You become tired by following some of those things. You want to go food and all that.
Despite the low numbers, disease had adverse effects on the region's economy. The situation worsened after at least 40 countries reported a second wave and new variants of the disease. The fatality rate during the second wave grew as well. In 55 countries monitored, Africa CDC reported that 20 among them reported fatality rates above the current global of 2.2%. As of Thursday, the Africa CDC listed 5 countries that account for 66% of COVID cases in the country, namely South Africa, which accounts for 38% of infections at 1,524,174. Morocco at 12%, translating to 487,286. Tunisia 6% at 239,368. Egypt 5% at 188,361, and Ethiopia at 4% with 169,878 cases reported. Burundi is the least affected country with only 3 deaths and 2,369 confirmed cases. Eritrea and Mauritius follow at 7 deaths, 2,988 cases, and 10 deaths at 641 confirmed cases respectively. The arrival of the vaccine in the continent was a welcome reprieve, but experts warn it is not the silver bullet.
Even if you are vaccinated, it doesn't mean that you won't get the virus. You will get the virus, but you will not be severe, because the body will already have antibodies to fight the virus.
The experts further say that continuous humanitarian aid and communication is key in keeping the masses informed on the dangers and mitigation measures to deal with the pandemic.
So it's just funding with those areas, and we will always support the government to increase funding in research institutions so that there will be homegrown materials, either drugs, either vaccines, moving forward, and even equipment, so that you have equipment which are done in Africa with the temperatures in Africa.
The continent may be doing better in terms of infection and mortality, but health experts warn that we are not out of the woods yet. Going forward, the experts are calling for a unified response to the pandemic and adherence to mitigation measures put in place to curb its spread. Yusuf Farah, Channel 1 News, Nairobi.